Okay. Anyways, some tests which should be done just as a patient in general. The following tests will be performed, and look at the bottom part. They'll be performed every 3 weeks. This is just to track progress, so they'll be done 3 times over the course of the 9-week training plan. So the first is VO2 max, which we've talked about a lot in class, but just in case you've forgotten or you don't know, VO2 max is a measure of the maximum volume of oxygen that an athlete can use. It's measured in millimeters per kilograms and body weight per minute. So it's ml over kg over min. So pretty much as you increase your effort when you exercise, the amount of oxygen you consume increases, obviously. However, there's a maximum level of oxygen you can consume, beyond which increase does not lead to further increase in oxygen consumption. This is called the VO2 max, and the initials simply stand for the volume of oxygen. VO2. So, some experts believe that VO2 max is a key physiological determinant of an athlete's running performance, and that is an important objective of a training program to improve it. Other sports scientists argue that there's limits to an athlete's running performance are determined by a range of factors, such as muscles, running efficiency, metabolism, and VO2 max is only just a small part of this. So, yeah, this is very important because with racquetball, although it's not like running a marathon or anything, there's still a lot of jumping back and forth and hitting and such. So this is really important. And another test we're going to perform is because our patient would also like to lose some weight, I think, is a skin fold caliper test. And essentially what this is BMI, but it's far more accurate and it's better than BMI. Because with BMI, for example, you could have someone who's very large but muscular, and they'd be considered obese because of their BMI, because it's just a simple ratio. But skin fold actually like takes the skin, you clamp it using a clamp thing, and it determines the lean body mass you have. So it just, yeah. So pretty much we'd get an athletic trainer or a dietitian to do this because it really depends. Because if you do this by yourself, they tend to be inaccurate. And so, yeah. And then we have our BMR and our TDE, and our BMR is just your how much like your metabolism's burning and stuff. We've talked about that, and I think it was like 3.2.5 in January or something. And then we want to measure the range of motion on his meniscus and hopefully try and get that up with some of the exercises Celia talked about. But because it's really important, because he's had that injury on the meniscus, that might be an issue. We're also take his food intake that's not really a lab test, it's just more of like he needs to keep kind of like a food diary and see what he's eating and how much of it he's eating so we can see like what exactly we need to change in his diet. Whether it's going to be like a huge change from his diet or if it's just going to be really small. And then another thing which is really important, which I've talked about this before, is we'd like to get a broad spectrum mental health exam because it's just something, in my opinion anyways, in the opinion of uh, a lot of psychiatrists and psychologists, that it's really something which should be part of just a regular checkup with a doctor. But unfortunately, there's a huge stigma on mental illness, so this doesn't exist. But anyways, if that's not convincing enough for you, it's from the World Health Organization, 1 in 4 people in the world will be affected by mental or neurological disorder at some point in their lives, so whether they're having it or if they know someone who has it. Around 450 million of people currently suffer from such conditions, placing mental disorders among the leading causes of ill health and disability worldwide, and this number is just going to increase. Treatment is available for mental illness, but nearly 2/3 of people with a known mental disorder never seek help from a health professional. Stigma, discrimination, and negative and neglect prevent care and treatment from reaching people with mental disorders. Also, a huge thing also is geographic distance. Like in Montana, you could live in 2 and the closest mental health or psychiatrist or psychologist could all be away in Billings, like 4 hours away. So those are some of the main issues affecting people who have mental disorders. So, anyways, again, these are the tests to be taken, and they'll be performed every 3 weeks to measure progress. Okay, and then we'd also prescribe our patient a small amount of OxyContin, which is a narcotic painkiller for his knee pain because it most likely would come back because of this meniscus injury. So we'd keep that and we'd regulate it. And also another thing is he should take multivitamins because a lot of people don't, but it's really something which should be a crucial part of an everyday routine because it helps fill in gaps in your diet, which can just lead to better overall health. Uh, is that it? Yeah, that's it.